Affairs, Dr. Nkosazana Dlamini-Zuma, together with Health Minister Dr. Zweli Mkhize, are briefing members of the National Council of Provinces on the work of government to deal with COVID-19 pandemic. It's a virtual meeting. There you can see Dr. Nkosazana Dlamini-Zuma. Let's take you there now live.
Particularly given the role of the National Council of Provinces plays as a meeting point to the public representatives of the three spheres of government with regard to oversight and accountability. We felt, honorable members, that it was necessary to create space to broaden and deepen our understanding of the spread of the virus, and government and other efforts aimed at limiting its negative impact. The World Health Organization, who declared the coronavirus outbreak a pandemic in March this year, in their wisdom, the virus was likely to spread to all countries on the globe. Needless to say, this has happened, and our country is one of those affected. In declaring the virus a pandemic, the World Health Organization stressed that countries should be implementing a strategic combination of both containment and mitigation measures. According to the strategy, containment involves trying to detect and stop known chains of transmission by isolating cases and following them up and potential quarantining their contacts. While mitigation involves community-level steps like social distancing and comes into play when the virus is spreading more broadly, we note, of course, that various stakeholders are critical in ensuring that all of these efforts and all of this work is done effectively. At the time of the outbreak, we had little knowledge of the impact of the virus in our country. There were, of course, many theories that were driven by public opinion. On one hand, there was a hope that we could be spared the wrath of this invisible enemy. While on the other hand, there are postulations that given our challenge health system, the virus would wreak havoc once it permeated the length and breadth of the country. We have since witnessed how the virus is spreading and the potential damage it may cause. We are being advised to prepare for the worst. This briefing will elaborate on these matters. Our country, Program Director, like many countries across the world, including India with a population of more than 1.3 billion, imposed lockdowns with a view to save the lives of their citizens. But as President Cyril Ramaphosa observed about a month ago, quote, our lockdown has revealed a very sad fault line. It's a very sad fault line in our society that reveals how driving poverty, inequality, and unemployment is tearing the fabric of our communities apart, close quote. Program Director, this reality as articulated by the President, coupled with the crisis of the spread of the coronavirus and its resultant impact, should galvanize us to respond appropriately to the dictum that we must never let a good crisis go to waste. Therefore, the lockdown must serve as a catalyst for an informed reassessment and recalibration of our program that are aimed at improving the quality of life of our people. As is being said, going forward, we must adjust to a new norm with regard to how we do things. I know that this is easier said than done. Program Director, we must commend government for spearheading the efforts aimed at promoting adherence to the rules of hygiene and on implementing the lockdown. Today, many South Africans are acutely aware that the virus thrives on mobility, on proximity, and on density. Lastly, as I conclude, we note, Deputy Chair and Program for the Day, that Minister Nkosazana Dlamini-Zuma may, due to other pressing government engagements, not be with us beyond 12 noon. This said, Program Director, allow me the privilege to extend a word of welcome to both ministers and everybody who is part of this important briefing session. Thank you very much. Thank you very much, Deputy Chairperson. Been cut off. And I hope that as soon as possible she'll be connected. Are you back, Deputy Chair?
I'm back. I'm trying this new things and it's not working nicely. I'm going to back to my old things.
Chairperson, on a point of order, this is Honorable Labuschagne. With the chat that is disabled, it's very difficult to communicate. Some of the people have a poor sound. Can we just attend to that, please? Thank you.
What is the issue, Honorable Labuschagne?
The people complaining that the sound...
The chat icon is disabled, madam.
What is disabled?
The chat icon, but I raised it with Zama and IT.
Is it not for security?
We usually use the chat just to when people want to chat with one another. So as long as the video and the audio is on, can we continue? May we continue, please?
Thank you, Chair.
And then you can, in the background, deal with that issue. Because the Honorable Minister Nkosazana Dlamini-Zuma will only be with us up until 12. So I think we need to start immediately with the presentations. Both presentations from both ministers will take 30 minutes each. And after that, we will be having the discussion. And then there will be a second session that will be chaired by the Honorable Nyambi. That will be the program. In the meantime, can we allow ourselves to listen to the presentations and to watch the presentations that will be done by the Honorable Ministers? We will now give over to Honorable Minister Nkosazana Dlamini-Zuma. Welcome, Minister. Thank you very much.
Thank you, Deputy Chair.
Thank you.
Thank you very much. I'm sure somebody will show the slides from your side. They were sent to you, but I will start whilst they are fixing the slides. Just to say that COVID-19, as honorable members, honorable chair, deputy chair, and all the honorable members and Minister Mkhize. As the chair has said, that this is one of the greatest health pandemics since the Spanish flu. And of course, it's not only a health pandemic, but it has also become an economic crisis, which has also shown how South Africans, how the fault lines in South Africa, how deep they are. We've seen hunger, poverty, unemployment, and just conditions under which our people live. And we can no longer hide from those. So this pandemic then made it necessary for us to have a lockdown, which the Minister of Health will speak at length. But it was to achieve the slowing of the spread, flattening of the curve, and making sure that we do not have an unmanageable pandemic. And now we are at a point where we have to ease the lockdown. We have eased it. Now we are at level 3. The president did announce where we are. But the president himself has said that we mustn't have an abrupt and rapid lifting of the lockdown, because that might cause a massive surge of infections, which we may not be able to manage. And of course, with the closing of the lockdown, closing of business, we've seen how the livelihoods of people have been undermined. And it is for that reason that we really are now looking at opening, and the president has opened the economy in his announcement. And this pandemic is not only ours, as we have said, it's a global pandemic with 5.5 million people across the world. Can you move the slides? 5.5 million people across the world infected, and almost 350 people have died. And the economy is going to shrink, trade is to shrink globally. And of course, a lot of countries have had to find some money to stabilize their economies, or to assist people, cushion them from the hunger and from the poverty. South Africa also has had to go to multilateral institutions to try and find money. Our reality has been, from the first case on the 1st March,
Is there anything wrong, Zama? Can we see the presentation? Is the minister now gone? Minister? Hello?
Deputy Chair, we're locating the minister.
Okay. Why do we have problems today? More time.
Honorable Deputy Chair,
I'm listening.
in the meantime, there are about 3 members of parliament who are still locked out. Can administration also assist in terms of facilitating their entry to the meeting, please? I don't know who to
Can you
talk to, but
Do you indicate to Zama them who the people are so that they can immediately
Yes.
try to log in? But what, Zama, what is happening to the minister?
yes.
We seem to have lost the minister, but we are locating the minister, Deputy Chair.
Are you trying?
Yes, ma'am.
Because we don't want to continue before we know what is happening there.
All right, there you have it. It seems that they have lost connection with the Minister of COGTA, Nkosazana Dlamini-Zuma. They are trying to re-establish connection. But basically, the minister was talking about this COVID-19 as one of the greatest challenges, not only faced by South Africa, but around the world. And it poses this economic challenge as well, faced with stark reality of the living conditions. And she spoke about the triple threat that we often hear about and how this can exacerbate that, and I guess really emphasize or highlight the fault lines that currently exist in South Africa, talking about hunger, poverty, unemployment, etc. We understand that we have connection with the minister. Let's go back there now live.
Liquidation or retrenching some workers. Tourism sector, of course, going to be hit hard because we have closed our borders and we have also closed tourism within the country. So that sector is going to be very hard hit. The turnover of companies show that 90% of businesses show that they'll have a lower turnover, and about a third of them indicate that they were going to lay off workers either temporarily or permanently. The trading activities have declined. And of course, some of the businesses, as I say, will not survive. Unemployment will rise, tax collection will be low, and the vulnerable households have lost a lot of income. Can the person who's moving the slides move them, please? I'm on slide 8 now.
Yes.
Yes, okay. The informal traders, there have been devastation of them not being able to work during the lockdown. Poverty levels have increased. And there's been a very strong decline of municipal revenue. And this is estimated at the moment between 20 and 30%. It could be much more depending on what happens. Whilst the revenue of municipalities has declined, the demand for infrastructure has increased. For instance, water, sanitation, which is basic, is under demand, but municipalities don't have what it takes to supply those. So national provinces have had to pitch in, but we know that even in the schools, water and sanitation is a problem in some of the schools. And there's some of the things that have to be sorted out before the schools can be opened. In terms of how we have worked, we all are aware that there is a National Coronavirus Command Council, which is chaired by the President. which was established after the declaration of the national state of disaster. And below that, at a technical level, the net joint, but also there is a ministerial committee that looks at and does regulations, taking decisions from the NCCC. And then we have the PCC, which is the intergovernmental part of this structure. Instead of it just being the president and the premiers, we've included the MECs who are in charge of disaster in their provinces to attend these meetings. And also the national chair of the chair of the National Council of Traditional Leaders, of course, the president of SALGA as well, so that all the relevant intergovernmental structures are represented. And sometimes we do also have district mayors. And then at a provincial level, those structures are also duplicated and they cascade down to the districts and local. And we get information from the local and the districts, which cascades up. And of course, the information also cascades down from the national to the provinces and the local. And the strategic response that we've had is based on aggressive communication so that our population can adjust behavior. Because at the end of the day, without adjusting the behavior of each and every one of us, this pandemic will not be fought successfully. So that communication is important, not only at the national, but it's important that all the spheres of government communicate aggressively, but all the public representatives also communicate the same message. And this has happened and is continuing. The various sectors, I won't mention them, all of them, but there's been communication with various sectors, not only at the beginning, but even as we change to level 3, there's been lots of consultations, because we now have what is called the risk-adjusted approach to the lockdown, which means the lockdown is divided into levels, which go according to the rate of infection, but also the rate of readiness of our health services. And these extraordinary measures have assisted us, because we're at the beginning of the lockdown, as the Minister of Health will say, we were not ready, and he will give how ready we are now, but it has given us that chance to really get our health services up and ready for the pandemic. But we also have to look at socio-economic impact of COVID, which is a very devastating impact, and we have to mediate that, and we have to build resilient and sustainable communities. And as we rebuild the economy, we must also be looking at how the rebuilding of economy builds those sustainable and resilient communities. And I will just go through the next slide that talks about the levels. But in addition, the Minister of Health will talk about hotspots in addition to the levels that you see. The next slide, please. Level 5 was where we were with the lockdown, which had very stringent measures and restrictions, which was level 5. And then level 4 has got still high restriction. Level 3 has got moderate restrictions because our readiness is also much better. And then level 2 is a high state of readiness. And level 1 is supposed to be low virus spread with high readiness. In our case, the next slide just shows a rough distribution of the infections. And I won't go into details about that because the Minister of Health will be speaking. But it shows the darker areas are where there's legal infection, and the lighter areas have moderate infection, and the red have got high infections, but Minister will deal more with that. And of course, there will be, as we go into level 3, there'll be hotspot areas. I won't go into detail with that because the Minister of Health will deal with them, which will have different measures, not necessarily a different level for now, but maybe later if we don't manage the infection. So I'm just skipping those slides because now I know the Minister of Health will be here, so I don't have to deal with them. I'll just go to slide 17 then.
I'm sorry to interrupt. Chairperson, I'm sorry. If I may raise a point of order, please.
Raise your point.
Thank you very much, Chair. Minister, again, I apologize for interrupting. Unfortunately, the chat section is disabled, so I couldn't raise my concern there. Minister, your sound quality is quite poor, and you appear to be uncomfortable. I'm not sure if the mask is what's causing the problem, either with your comfort or the sound quality. But, looking at your video and there's a mirror behind you which shows that you're not in a room full of people. Can I ask perhaps that you remove your mask? It will certainly help us to hear what you're saying. I know that this video is being broadcast on television, and I know that a lot of people are interested in what you're saying. Thank you.
Thank you, Honourable Member. I think we take note. Honourable Minister, yes, you still have around about 10 minutes, so you may continue. Can the host staff please give attention to the technical issues that are being raised, please? Can we continue?
Okay, I will just move on. Is it any better?
It is better. It is better. It is better now.
It's definitely better, so you can continue. Thank you.
Thank you. I'm sorry about that. If we look at the regulatory framework of how COGTA specifically is dealing with this, we have the Disaster Operations Center, and of course there is service delivery and infrastructure delivery. There is service delivery support to municipalities, water supply interventions together with national, and then communication, and we are trying to ensure that even as COVID is being fought, we do fight it using the district development model because it is the best way of dealing with it, because everything that happens at the district. So we are trying to ensure that even national departments, as they do their work, they do it through the district development model. And of course, this requires that the national executive to deal with a national disaster in terms of existing legislation. And we know the legislation that is being used is Section 27(2) of the National Disaster Management Act. And so that is what has been happening since March 15 when this was declared. We have also been giving directives to the local government in terms of what they can do at different times, and different ministers have been giving directives also to their sectors as we have been moving through this lockdown. The COGTA Disaster Operation Center operates daily. It's got a 12-hour shift. It's staffed primarily by COGTA senior managers and the National Disaster Management Center managers and some of our ICT staff. Since its activation on the 26th of March, COGTA has contributed significantly to respond of local government, and it interfaces with the provincial disaster management centers, metro and district disaster management centers. And of course, we also interact with the NERC joints at the national level. We receive reports from the provinces, and the province receives reports from the districts. We receive reports from the provinces, and we report to the national joints. And we have a dashboard that gives us pretty much what happens according to our information that comes from the provinces. And of course, the next slide is just the information about the infections. One of the things that we've had to do is to working with the districts and working with the Department of Public Works. We've had to help identify the quarantine sites which are needed in every district for those who cannot quarantine themselves at home. And that work has happened and continues to happen. Also, the provinces are working on that. And we also are working to identify critical infrastructure that needs to be addressed during COVID. As I said, some of that infrastructure is water infrastructure. And we've had to mobilize resources through other partners, but also assisting the municipalities and the traditional leaders with some of the basic things like sanitizers and so on. And of course, it has also, the lockdown has had implications on our work in that, for instance, the local government by-elections have not taken place. The IDP meetings are not able to take place in the usual way, so they've got to do it they've been working through WhatsApps and all those, which are difficult. But at least now the municipal councils will be able to go back to work as long as they are able to keep the social distance, the masks, and all the protocols that are necessary. We have, in the short term, distributed some hygiene packs and antiseptics and soaps to different provinces. And we are, whilst the Department of Water Affairs is giving emergency water, we are trying to, through MISA, to develop sustainable water sources, such as drilling and equipping boreholes and fixing water and sanitation infrastructure where we can. And we have mobilized also money for service delivery towards COVID. Some of the partners that we have partnered with to mobilize this money is Tirisano Construction Fund, and Tirisano is also assisting us with these sanitary and hygienic packs, but they are also assisting us with boreholes in Gauteng and in KZN, and also assisting us with sanitation infrastructure. We're also partnering with the Development Bank of Southern Africa, DBSA, and they've assisted us actually to strengthen our National Disaster Center.
Deputy Chair, I'm sorry to interject. On a point of order, please.
Order is this, order is?
It's about the feed on YouTube. It's been lost. If we could just have a look at that, please. Thank you.
Honorable members, can I request that issues like that, can we just actually report it to the host officials so that the presentations can be finalized, and we will also raise issues after that. And the chat is on now.
I
report
agree.
it on the chat line.
Agree.
Okay. Thank you. Can we continue, Honorable Minister?
Chair, the chat has been disabled, so we cannot report it to the staff. That's the problem.
I just saw a chat. I just saw a chat.
Our oversight, Chair.
Honorable Member.
It's now sorted.
Honorable Member, I just saw a chat.
The chat is working.
So it's sorted. Can we then continue, please? Honorable Minister, I'm sorry. The chat is sorted. I'm sorry about the interruptions. Can you continue?
Okay.
Honorable Minister, are you there?
Yes, I'm here. The Development of Southern Africa has partnered with us as well, and we are working with them. They've strengthened our national disaster management capacity. They've employed 8 people and seconded them to us, which has been helpful. And they are also assisting in drilling and equipping boreholes and refurbishing some of the boreholes, and also purchasing some water tankers and fixing some pump stations. So that partnership is going on to assist with the water. And the Municipal Infrastructure Support Agent, MISA, is also working on the water issues, particularly boreholes, because we, as I said, whilst there is emergency water supplies that are needed, but we also need to continue with providing more sustainable water through boreholes. And we've also asked the MIG grant that was not going to be used, that was going to go back to Treasury, to see if it can also be used to assist with water interventions in the municipalities. And then I'll just deal with communication. The communication team has been working collectively in government through the GCIS, and not joints, but also provinces have got their communication teams. And I think though the communication has been better than it ever been in government, I think there's still a lot more that we can do to improve the communication, especially now as we open the economy, to make sure that citizens still understand that the health protocols are very important. And in terms of the district development model approach that I said we are taking, we are trying to ensure that all the work is done and that the virus and health facility readiness are done according to districts, so that we know what is happening per district and working in a collective intergovernmental structures. And in terms of the district model, the president has now agreed that he's going to be announcing ministers and deputy ministers who are going to be champions in each district, so that there is a focused attention on the districts. And that will happen soon. And we have the profiles of the districts, and fortunately health also is structured in that way. The health department is structured per district, and so that coincides with our own districts. So the social development, water, and all the other departments have to work in the districts through the district development model. The relief funds have to also be done through the districts or local government, because the local government is at the cold face of this pandemic, and so everything has to be done through there. And we have to improve the political participation, and we hope that the public representatives also will be concentrating and looking at these districts as part of our general work and oversight work. But of course, all this there's been lots of challenges in terms of sticking to the regulations, part of the inter-provincial travel, which is not yet allowed except for business, now that business is going to be open, and for funerals. But the inter-provincial travel is still a challenge, because if you look at the areas where the infections are most, it's in the big economic hubs. And that's where the economy is being opened. That's where the majority of the population is. And the other provinces have got lower infections. So if inter-provincial travel is allowed freely, not just for business and for funerals, we may find that the spread of the virus will quickly go into what would be safer provinces for now. If we allow people who are coming back from work, from home, who are coming to work in all these big economic hubs, to be going up and down, weekends, going home, then they'll take the virus with them. And then before we know, the provinces that we think are safer will become very infected. So that's a big challenge that still remains. And of course, it's not a nice thing to keep interprovincial travel restricted, but I don't think we have a choice at this point in time. And we also still have our borders closed, except for cargo or for people who are leaving back to their countries, or South Africans who are coming back home. And there are challenges also with litigation. We deal with lots of cases almost daily. People litigating one part or the other of the of the regulations. And of course, also the problems that I alluded to earlier of just people needing food and people needing work, the poverty that has been exposed, and so we also expect that unemployment may rise up to 50%, and this is a big challenge. But and also public meetings, general public meetings are still a challenge because we have...
Deputy Chair, sorry. Honourable Klute here.
I'm listening, baby. See?
My apology, Minister. I'm just, this is not a sitting, so I'm not sure whether this is a point of order. Just a question. We now understand that the Minister needs to be at another place at 12 o'clock. You also indicated
Honourable Klute, please, my dear, can you allow me to chair the meeting? Because I think in most instances, even if the Minister is gone, the Deputy Minister as well as the Minister of Health will be able to assist with the questions. So can you allow the Minister to finish the presentation and then we will raise our issues and then we will continue.
Can you mute his mic?
Can we just get order? Even if it's, can we order? No one is responding. I'm chairing this meeting. Can we to do a presentation? We will raise our issues and we will make sure that we did provide for when the Minister is gone, there will be people able to respond to all the issues.
There won't be any time left here.
The presentation. No, the Minister don't have time left. So in that time, that it is exactly because members are interjecting that I'm allowing the Minister more time because we should have finished at 1:45. But because every time there is someone coming in, we are allowing the Minister to finish the presentation. Minister, can you continue?
Okay. Thank you very much. There are lessons that we have learned. I won't read them in the next slide. They are there to save time and to thank you very much for allowing me to present. I'm sorry. It's just that also when we were invited up to 12 o'clock. And so we arranged other things after that. But I'm sorry about that. Thank you.
Thank you, Honourable Minister. Minister, everyone, we have arranged that after the two presentations, questions for Honourable Dlamini will be taken, and then we will remain with Honourable Mkhize. But I want to announce the Deputy
Chairperson, on a point of order.
That special delegates that are present, can we please be allowed to continue with the meeting the way we have planned this meeting, and we want to make sure that people will be able to get. Honourable Michaelakas, your order is what?
Please look at the hands being raised.
Thank you very much, Deputy Chairperson.
Honourable members, I am repeating, we are not taking hands now. We are having the presentations for now, and after that, we will take all hands up until the meeting is finished. The Honourable Dlamini-Zuma will be excused at 12. So can we allow the presentation of the Honourable Mkhize to continue? Now we've seen there is a lot of overlaps, so I suspect his presentation will not be as long as the first presentation. For now, let me acknowledge the special delegate and let us then continue and give to the Honourable Mkhize to continue with the presentation. After that, it will be open for everyone that have raised their hands. You will ask your questions, you will get your responses. Like I said, when the deputy ministers will still be available, and we will continue. Can we then now get Honourable Mkhize?
Do you not recognise my point of order?
You're experiencing.
Deputy Chair,
Honourable
my point of order, I recognise that. Yes, thank you, Deputy Chair. Deputy Chairperson, just I'm not part of the whippery.
Problem that the members are disrupting the program.
Can other members mute their microphone so that we can hear the person that are speaking? Because of the fact that other microphones are open, we cannot hear you, Honorable Mikalakis.
But they are disrupting the program, Honorable Deputy Chair.
Can we have order in this meeting? Even if you don't see me, don't undermine me. Can we have order here?
Thank you, Deputy Chair.
Honorable Mikalakis.
Deputy Chair, as a member who's not part of the whippery,
we don't hear you. We don't hear you.
Sorry, Chairperson. As I said, as a member who's not part of the whippery, the communication that I received was that this meeting was actually scheduled until 3 o'clock this afternoon. Now, I take the point that you've mentioned about the Minister of COGTA. However, I have to bring it under your attention, Chairperson, that earlier this week, we also raised objections, and the week before that the Minister has not yet appeared before the Select Committee. Now, this is the first time we actually have an opportunity to speak to the Minister. We are also deprived of this. I find it very order that this Minister is not accountable to us.
This is not
and if she doesn't want to be a Minister, she should resign.
That cannot be sustained.
That is not even a point of order. Honorable Mikalakis, I've got the program right in front of me. Can we have order here? I can see really the DA members, you've been missing me. That is why you are going on like that. You've really been missing me.
No,
Honorable Mikalakis, according to the program, we are ending the meeting at 1. According to my program, we are ending the meeting at 1. I haven't seen anything about 3 o'clock unless you got something different from mine.
Chairperson, I would request that you seriously work on the communication with members.
Can we again
available until 1 o'clock?
Can we again request that the presentations continue? Can we again request that the presentations continue? Over to you, Honorable Minister Mkhize.
Back to the norm, original plan, only presentations, no time for questions. That is what you're stating here, Chairperson. We all know what you're doing.
I am surprised. I can see really the DA is missing me.
Thank you very much, Chairperson. I will proceed with the presentation.
Thank you.
Thank you very much to honorable members. I'm not sure if your prediction was right that we're going to have a short presentation, but we will try our best, Chairperson.
Please do. Please do.
I think the first point to make here is that it should be made clear to our people that the COVID-19 still remains a reality, a danger in reality, which is worse now than it was when we first had our first case. It's important for us to say whatever we are doing, we must be aware that we are facing a much bigger COVID outbreak challenge than we did when we went to all the lockdown. That we have seen our numbers increasing with the lockdown to 23,000 and above, that the risk from the health system, we now have 955 people in hospital, 126 in the ICU. And so it's important for us to always remember that the problems from COVID-19 are actually increasing, even though we might now be used to the fact that there is COVID-19, but it's a little bit more problematic now than it was before. What we have learned is that flattening the curve early is important. This we compare with what we've seen when we compare ourselves with the United Kingdom. And this was important to slow down the transmission. And if you look at the curve that we've put on the slide, it indicates that the orange curve there is a no intervention curve. The second one is what we would like to see as the ideal situation. The two lines that you can see are basically indicating that with the surge and the difference of the curve, we needed a bit of time to be able to improve the capacity of the health system above the usual level of the services. So this is what the lockdown was meant to achieve. So we believe, therefore, we've been able to flatten the curve for the first part. But of course, I think it's important that we understand that flattening the curve is an everyday event. It's not once off, and therefore we did it and that's it. It's an everyday event, and if we lose our focus we actually get the curve to spiral up again. So in this case, we needed time to make our people to be aware of the dangers. We've actually gone on to put up tests. We're almost just over 600,000 tests. We've actually screened 13 million community members and 13 million. And then, of course, we've been able to identify 44,000 contacts and try to isolate as many of them as possible. The total cumulative cases reported now, the figure is 23,615. And the case fatality rate at a national level comes to 2.22% at 481. And the number of recoveries has gone to 11,917. The slide shows, we will share the slides to the members, chairperson. So we just want to make sure that you can follow and you can start the presentation later. Then we're looking at the cumulative cases and weekly rate of change. It shows the increase. From where we sit, we believe that we're now dealing with the internal transmission, which is a second wave of what we would have expected. But if we had not done the lockdown, we would have actually been hit much earlier because of the fact that the first part of the pandemic would have actually been unmitigated. So here we're indicating the weekly change in terms of numbers. We will notice that as the numbers are increasing, the last week actually was responsible for almost 25% of the increase, and that these last 2 weeks now would be responsible for close to just about 45% of the numbers of people who are positive. If you look at the provincial distribution, you will notice that the Western Cape is where the largest number of increases have been, and that, of course, Gauteng is next, as we've seen in the previous slide. Then, of course, the issue of the cumulative deaths, they're already starting to show an upward slope, which is what we are already seeing largely coming from the Western Cape. And the Eastern Cape, the numbers in concrete terms of deaths are those that you can see. Sometimes the smoothness on the reporting would be delayed by the fact that some of the numbers may be taking a while to verify. And therefore, when they come up there, it doesn't necessarily mean that all happened on the 1 week. It could be just on the one day when it's reported, could be spilling over several days. Then when you look at the testing, and I would like to just make a point here, that we've done 596,000 tests, as you will see. And of these tests, in the last 24 hours, we've done the 12,900. The day before, we'd done almost 20,000, and the previous days, we'd done 20,000. The decline here is actually occasioned by the world shortage of supply. We're now running into a difficulty with various suppliers not being able to meet our demand. And therefore, I think the whole world is scrambling to get all the kits, the laboratory kits. And so we are actually getting squeezed now. And that's what's going to cause us a lot of backlogs, which we're already starting to experience. And that's the delay that we're going to have to, it's going to mean that we have to go back and reorganize our targeting strategy in terms of testing. And therefore, we're going to have to rely on a huge balance of clinical presentations and clinical judgments as we look at how to manage the cases because of those tests. And I think that we need the society to understand that this is now becoming a constraint. It's not so much our capacity more than it is about whether the global suppliers are able to respond to our requests. And this is because everyone else in the world is actually looking for exactly the same thing. We look at the numbers that have been tested of the 596. We will notice that 11% of the total positivity rate was in the Western Cape, and that the next is Eastern Cape at 4.9%. And so this gives you a sense as well of the differences in the rate of infection in different parts of the country. So if you also look at the numbers of tests that have been done, The largest numbers of tests have been done in Gauteng, which is 33% of the tests. 22% were in Western Cape, and that was in Natal 16%, etc. This basically just says that there isn't a province that is testing less than others. We are relatively testing as much as what is possible from various provinces. So that, for me, says to us that the numbers of tests being done per province they are quite large. But what we're going to see is that because of the numbers of people who are infected in each province, the positivity rate is different. So if you went to Mpumalanga, you would do 169 tests before you get the first one, which is positive. But if you went to the Western Cape, you'll do 9 before you find out the ones that are positive. Overall in the country is 1 in every 25 cases, and this is a provincial spread that you've got. This slide is showing us that the numbers that were referred through the community testing, 178,000, and that the positivity rate that you can see is around 2.26%, and that's really been the average that we're seeing at that level. Contact tracing is another area that I think we should really focus on. The three colors indicate the total number of contacts, the green, total number of contacts reached, and then the total number that have completed 14 days of monitoring, which means we assume that they are not infected if they've got no symptoms and they have not tested positive. But what you will see is that most of the provinces have got a very good match between the green and the blue, which means that contacts identified and reached are very close. There are challenges, though. In the Eastern Cape, you will see at the top, it's a gap of 8,300 identified and 7,130 that have been reached. So that gap means you've got a risk of people who will be spreading infection because they've not been put onto quarantine and they've not been identified, assuming that the others were identified and quarantined. And if they haven't, then of course that means the problem becomes worse. If you go to the Western Cape, there's again a gap there between the identified contacts and those that have been reached. So the failure to reach is actually one that we should be able to note as a challenge. And so if we look into the table on the side, the Eastern Cape has reached 86%, the Western Cape has reached 83%, and those differentiations mean that there's a lot more work that needs to be done at that level to ensure we reach out all the...
Can we request members to please mute your microphones so that we can hear the minister. There is a lot of background noise. No. Continue, Honorable Minister.
Then thank you. And then we look at the recoveries. In the case of recoveries, we will notice we've given the figure already. Yeah. Out of 223,615, 11,000 have recovered, and we see the graph is showing that quite clearly there. Then we look at hospitalization. The numbers that are hospitalized are largest.
To try and get it back to NCAS sometimes doesn't work. I don't know why.
The numbers that have been increasing, you will see that in the Western Cape, hospitalization has gone up, isolation has gone up.
I switched to workflow. The reason I put it back into STOQ is because it wouldn't let me take it into NCAS. Okay. Cool. Okay.
Please mute the person undermining us.
Can the host official please assist people to host to mute their microphones, please? I'm just please requesting. Continue, Minister. I'm sorry for that.
In the last, thank you. In the last part of the slide, is showing the dynamics now in the Western Cape. The cases are hospitalized, 4,554. Then those others are in isolation. Then you've got already in ICU, you've got 91, and then you've got 50 of those are in ventilators, and then, of course, 150 are on oxygen. This is going to be a pattern you're going to see in all the provinces as the numbers increasing, because everyone is going to end up getting to be in ICU in the hospital. Of course, our estimation is that that's going to happen to just around 20% of the patients, because most of them will be asymptomatic or mild. Now, here again, we've got quarantine sites that have been activated. I think you will also notice that Eastern Cape has got 14% of sites activated. So, and also the Western Cape has got 29. Now, this is important because we have got a gap on the quarantines, on the contacts reach. That means we need to be activating more of those contacts to be taken to quarantine and activate more of these sites for quarantine. It's an issue if you've got very large number of positive cases, that you have got quarantine beds that are not activated. In the others, it doesn't quite matter because their numbers are in any case very low. But you can't have a large number of positive cases and a low number of and a gap in the contacts reached and contacts identified, as well as also low number activated. So that's what we need to deal with at this point, particularly from the East and Western Cape. Then the numbers of sites, these are the same story, but it's represented differently. So this slide shows us the reinforcement team from Cuba. All the provinces have happily received the Cuban teams. So we're now going to be sending them the teams from the military health services to reinforce. And so we're in touch with all the provinces, particularly Western Cape, Gauteng, Eastern Cape, KZN, where we want to focus with the reinforcement. But that's already work that's already going on in the various provinces. What we want to show in this slide is that the slide may not show too well, but if you look at the rate of increase before lockdown, we're looking at a 2 days doubling time at the time, which was our huge concern because we would have really been swamped if we allowed that time. Then as you moved on, after lockdown, we reduced the doubling time now to 15 days. This is what we would like to see, where you have a slow increase so that people recover before too many are too sick, because the 20% of those becomes too big to actually manage in our hospital. And then, of course, as we're getting out of lockdown, we are now worried that we're seeing indication that the doubling time might actually be reducing already. And so that's the one issue that of concern. Whereas when we looked at the original trajectory, we were actually all meshed together with the UK, and that's the one that we have plotted in orange. And then South Africa took a turn. So we haven't got any doubt that there's epidemiological evidence of the flattening of the curve. The question is, how do we manage the rest of the curve? Because the dynamics are very different now. It's internal transmissions, it's reopening of economic activities and normal social activities in a situation where the numbers are still increasing. It hasn't been done in most part of the world. In fact, the WHO criteria are basically saying to us we should wait for a decline in the numbers of new cases. We must wait until we can show that the risk of spreading the infection is lower. But we have actually had to, move on and reopen, even though those situations have not arisen. The reason for it is because there's a problem of crisis on hunger, on income, on economic recession, and also social distress with the various social supportive activities not being open. So it is something that we have to adjust to the fact that we would not be able to reduce the numbers of infections until we, before we open up all of this. We now need to adjust to do this in a slightly different way. So funerals, we've put restrictions, religious events, weddings, and musical festival, etc., etc. Now we have also seen that the lockdown, the hard lockdown, which was level 5 at the beginning, in its current form, we needed to change and readjust. And that's why the president came with what was called the risk-adjusted approach. And so we've then presented to the NCCC what we call a differentiated approach, basically where we say that the numbers of cases per district varies. Some have got very high, others very little. And therefore, we need to then make sure that there are stringent measures in district where there's low or no infection to try and keep the numbers lower. And then in the district with high infection, we have to actually bring in intensive action. So the interventions and restrictions have to be brought in alignment to the pattern of actions using a common toolbox that we'll show just now. So here the Minister of Health will identify the alert levels where we think we need to intervene and then recommend to the provincial, and then the Provincial Command Council will also make their own comments, and then this will be submitted to the National Command Council so that there is a determination of the extreme restrictions that are needed, the softening of whatever current restrictions that might be necessary. So from here now, since the president has announced level 3 that we're going to try and open up, we therefore we are advocating for vigilance and close monitoring of areas with low transmission, and that the high-risk areas are classified as low, as hotspots, and that we will then be looking at the various districts and classifying them in terms of what we see as being the major challenge that we see in those particular areas in terms of whether each one is seen as a hotspot or an area of low transmission. Then continued caution needs to be exercised over those who are 60 years with chronic morbidities. The approach basically being that as much as possible, there should be containment measures that are protective to the vulnerable groups at work, and where it is not possible, they should probably be working at home or staying at home. And so that's an issue that we have to keep in mind as we move on. So we have advocated for a district level alert system and also ensuring that there's a geospatial location of all cases and monitor them, and the implementation of hotspots and outbreak interventions, and that we have to keep expanding our capacity. And here we have to deploy epidemiological, environmental, and health infection control skills at different levels to work together at a district. So in terms of our differentiated approach, we are basically saying that we're looking for areas where there should be vigilance, and these are areas which we consider to be low transmission. That is, those which have got less than 5 cases, positive cases per 100,000, and hotspots will be more, are those with more than 5 per 100,000 positive cases per population. That the emerging hotspots must be watched, where there might just be a sudden change from low transmission to high transmission. We keep those in mind as well. And when we do so, we do so on the basis that those spots are not just the matter of the number of cases, but it's also in relation to the available health services in that particular area. So on areas where we're focusing on vigilant and we're watching out for emerging hotspots, we've indicated in this area, but our approach is that we need to focus on prevention of new infections and ensure that the number of new positive cases are consistently low so that the system doesn't crack. Surveillance and effective communication is important. Rapid finding and the isolation of cases. So the issues I raised about quarantine and the difference between identified and contacted contacts, it's important. And so with all of those, we have to now bring in a protocol based on the combination of all of the appropriate interventions in what we call a toolbox. Then we need to focus on community of behavior, social and behavioral change, dealing with issues of social distancing, environmental cleaning, hand hygiene, use of PPE, symptom screening, community and contact tracing. Sorry, that's a contact, not contract. and then testing and isolation, quarantine, hospitalization. That is standard now everywhere in the country. It has to be, and the communities on the ground, that is the local communities, civil society, everybody must ensure that this is taking place everywhere in the country. This is very important because this is the only way we're going to be able to contain the spread of the infection. Then we deal with district designated for vigilance, as I've indicated. We are looking at this toolkit, which is on the right here. This toolkit basically says that social distancing at 12 o'clock there, and then as you go anti-clockwise, frequent environmental cleaning, testing, isolation. We'll use all of these things until we get back to the top where we say lockdown. I'll come back to that issue as well as we move on. But basically this says all of these things will be employed depending on the need. And of course, some of them are going to be standard of how we do the interventions. So we've therefore classified these areas as areas for vigilance. This is a majority of the districts in the country. And on the right, we've put as a bit of a formula of a number of things that we take into account. I will not waste time with that. The hotspots area, here we have a number of districts with more than 5 positive cases per 100,000. And here we need to make sure that we go into each district, subdivide it into sub-districts, and get a cluster of wards and then deploy teams of experts. And these are the teams that are going to then move on a wall-to-wall basis to test, to isolate, to quarantine, to treat, and also make sure that they look after the health of all those individuals, and make sure as well that they look at comorbidities and also assist them to be treated even at home, even if they don't need to go to the hospital, because you've got the teams here of all the epidemiologists, you've got infection control specialists, public health specialists, nurses, doctors, social workers, psychologists. They will then, in a way that we have not ever done before, concentrate on a very small catchment area to ensure the wellness of everybody in that area. They will then cooperate with the private practitioners, the GPs, so that they work together in an area to contain the issues of ill health in the community. This will help us to make sure that you can actually keep a relatively large number of people away from hospital because they can be treated at home. Then with community health workers, they can actually bring their own treatment into their homes. Where they are concerned, the team, they can actually get the teams of family practitioners and public health nurses to see those patients without them having to go to hospital. Then you remove from the community people who have to be in the hospital. Those are the ones that ultimately get referred. But what we do, we ensure that all those who are positive cases who are still actively spreading infection can be taken for isolation, and we account for each and every one of them. But when you put these districts, you need to then know how many people are positive here and therefore account for each and every one of them. One who's positive must be isolated, the contacts must be quarantined, and we need to deal with it. Now that we're running in a challenge of tests, you will use clinical judgment to be able to say, we think that reasonable chances are this one is positive. Until we can, we can't be delayed by delays or backlogs in tests. We'll have the doctors making a clinical judgment, because now the rate of the infection is high enough to be able to know where the suspicion should really be based. It's still accepted as a clinical approach. And so we're going to be combining all of those issues as we improve the targeting. So these issues, therefore, take us to what the president was talking about when he was referring to hotspots. We're going to be putting a lot more of these particular actions in place. And then when we deal with hotspots as well, we have indicated all of these actions that I'm talking about. But in the event that all of those activities don't add up to reducing the spread of the infection, then you can consider lockdowns. Lockdown in a cluster of wards, lockdown in a whole district. Lockdown, that means basically the rate of the inspection is so high that it is important to actually contain the population in that particular area within one area. That's now when we're dealing with the Wuhan kind of situation. It is important again to indicate that there's a huge difference between the way we were using the example of Wuhan and what we're actually doing in South Africa, because in China, the first infection grew up out of Wuhan and spread to the various parts of the country. And because of that, they were able to immediately put a lockdown in one area for almost 50 days, where there was no infection for 7 days, and then they started opening it up. In our case, we're the reverse. We started by having the infections imported. So they were sporadic all over the country, so you couldn't lock down anything. All you could do is to stop the source of the infection, which is the international travel, which we did. Now that we have done that, we now got a whole completely different strategy to focus on. The numbers of people that have increased in the Western Cape are people who have grown up, who have become positive, they're infected in clusters, in retail shops, in factories. Now that is unfortunately what may happen now as we ease the lockdown in different parts of the country. But why did it happen? It means that if somebody was not detected early, because many people are asymptomatic, they were the services that were essential services, food processing, factories for medicine production, and so on. But when that happened, each one of the people who was infected went back to their townships and villages and suburbs and spread the infection there. That's why we're having this kind of explosion we're seeing in the Western Cape. Now, that does not mean that the rest of the country did not benefit from the lockdown. It just means in this case, we need to then focus on a much more intensive approach, because now 65% of the infections are coming from Western Cape. It's got nothing to do with testing. We have checked that, and all the comments, some of the people are making comments are ill-informed. The reality is that we've got more infections in the Western Cape, and that's what we must focus on, because it's already showing the trends in the Eastern Cape. The rest of the country will have the same thing if we don't manage to contain what's happening in the Western Cape. That's really why we have to deal with it and hotspots. Now, the issue of hotspots that are not responding to intensive medical team deployed into that area, environmental health officers and everything, would have to take additional steps. We would now have to treat it in the way that the Wuhan situation was. So it's important for us to be upfront that that's the way the strategy will go. At the moment we're not there, it's important that we deal with it. Right now, there's good cooperation across all the provinces, as you will be able to see, honorable members, that already the Western Cape here has actually subdivided the metro into all of these areas. We now got GPS location of each and every one member who is a positive case. We've also got a sense where the positive contacts will be. All that we're now doing is that each one of the areas must have its own team of experts. Those teams of experts are going to then make sure that those who are still not recovered must then be in isolation, in hospital, and then and except if their home circumstances are allowing that. But if not, they must be out in isolation. That's why those field hospitals are important, because even if someone is positive but asymptomatic, they must still stay out so that they don't infect the friends and neighbors. Then the others must go for quarantine. We've now reinforced the Western Cape with additional expertise from National Department to go and help them with additional ICT capability, with the reorganization of reinforcements, and the teams are working very well. And we really want to make sure that the approach is able to take the effect in this particular part of the country. As we move on, we will notice that these are the hotspots that have been released, and this is where we're going to be focusing this attention that I've just indicated. Gives you a same picture in terms of the map of the country where the hotspots are, literally in these particular areas. One of them in Mangaung has also been brought in as well because of the various history that we have come from, as it were. So for hotspots, there are further considerations that we'll have to take into account, as I've said: restriction of movement between high and low transmission, no gatherings, no social leisure, etc. So this will be in addition to what is being done anywhere else. So when we find that it's going to be a factor, then we'll actually announce that this is not going to happen in this area until we can contain it and then ease off. So the fact that everyone is in level 3 means that there will be level 3 plus these restrictions based on the hotspot interventions. Then the other issues that we have, the President has announced, routine health services being open so that we can manage the balancing up of COVID and other ailments, as you'll see, immunization, TB, HIV, etc. Workplace protocols for reopening are also being worked on. Schools and universities. This is going to be a start-stop kind of process because everyone is not used to COVID, and so it's going to take us a while to get used to it. But I think that it's understandable that we have to go that route. Then, of course, public transport. We're going to also have to ensure that there are strict rules around it. You know, by right now, everyone who's using public transport should be using a mask, and everyone should be and sanitizing. So when they hold on to the rails and the bus and the car, in the opening the doors, they should actually not be contracting infection in the process. So there were a few other high-risk activities which, even with level 3 or 2 or 1 for now, they are really going to be a challenge. This is large gatherings in terms of religious, cultural, music, and sports. Of course, the consultation around reorganizing religious activities was ongoing, so that there were certain suggestions that the presidency was looking at in this regard. Otherwise, the toolbox I've spoken about, the need for PPEs are very important, that these measures now will remain in place at all levels: social distancing, hand sanitizers, cloth masks, elderly be protected, no public meeting. Again, we need to ensure that the huge campaign now, national communication campaign, and also make sure that we focus on social mobilization for solidarity. Everyone must protect the next person, and each one must take responsibility not to be infected. So largely, Chairperson, I'd like to say that's where we are. I'd like to bring this one to a close with the point that basically says that we are entering a new territory. There's going to have lots of lessons for us, but cooperation amongst us is going to be the way to deal with this, and the unity of South Africans is going to be important. And respecting really the guidelines and protocols, because that's what's going to make a difference between spreading the infection and also cutting down the infection. Thank you very much. At this point, I'd like to bring to a close. Thank you very much, Chairperson.
Thank you very much, Honourable Minister. I will just request the host officials to indicate the members that have raised their hands, because open the video, because I am having a slight problem with the issue of the video. Can we just get an indication? Ordinarily the chairpersons will speak, but we will put them a bit later. Can we have questions for Honourable Dlamini-Zuma, so that we can allow her to leave when she's ready to leave? Unmute her. Unmute her. Hello?
Yes, ma'am.
Zama. Can we have the names? Mute Maria Saratakanor. Mute that one. Can I hear the name?
Yes, ma'am. We've noticed the question from Honorable Klute.
Klute.
Honorable Oka.
Klute.
Chairperson, my questions is to the Minister of Health.
Can I have at least 5 names?
Yes, ma'am.
Yes. Honorable Klute.
Chairperson.
Can I request that members allow for the host officials to give me at least 5 names? Then we will continue.
Chairperson, my name is mentioned, but my question is to the Minister of Health, so you can disregard my name now.
Wait a bit, thank you. Can we have the next name? Zama, can we have at least 4 names, and then I will add the chairpersons. Honorable who? Bishop, yes.
Very much. My question is also to
speak now, members. Wait, I want at least 5 names, and then I will allow you to speak. Can I have the name? Honorable Bishop. Honorable Bishop, and then
Honorable
Mkhize.
Honorable
Yes.
Honorable
Mkhize, Honorable Dodovu, and who else?
Honorable Nicola, please.
Like us, okay.
Honorable
Members, in that order for the first round. 1, 2, 3, 4, 5. Honorable Bosov, can you start with your question?
Point of order, please. Chair, point of order.
You will speak, Honorable Mutamai. Can we allow Honorable Bosov to
Chair,
speak now?
on a point of order.
I'm listening to your order.
Thank you, Chair. Chair, what is the use of the group chat where we indicate that we want to speak if that doesn't seem to be used? Because I was the first person to indicate.
There is a on the gadget, there is a place where you raise your hand when you want to speak. It's not necessarily, I'm not necessarily seeing all the
Chair,
chats.
you are making
So you raise
the
your hand
rules as you
and
go
I get
ahead.
the indication.
This is unacceptable.
Can we continue? Can we request Honorable Bosov to come with your questions, members, please? We are wasting each other's time here. Can we have the questions? Honorable Bosov, it's your turn.
Thank you very much, Chair, Deputy Chair. But my question is also to the Minister of Health. So can the next person go?
Yes, we can go. Honorable Labuskaghni. Honorable Labuskaghni.
Thank you very much, Chair. My question is to the Minister of COGTA. There is currently no proof that the prohibition of cigarette and tobacco sales decreases the risk of COVID-19. More specifically, there is no negative consequences of smoking that has been stopped through the ban, unless the Minister can point it out. Smoking continues, but the industry has been taken underground. The only logical conclusion is that this is the sole aim of the Cabinet and specifically the Minister with regards to this ban. The Minister is known to have visited Greece and the United Kingdom with Mr. Mazzotti, who now denies that they are friends. Where will the two unfriendly travel partners be going with your profits once the lockdown is completely lifted, Minister?
3 minutes, Honorable Member. Can we continue, Honorable Mkhize?
Thank you, Chairperson. Honorable Minister, with the current lockdown regulations being relaxed and with all the concerns relating to water in villages, particularly in Joe Morolong local municipal area in the Northern Cape, Giani in Limpopo, and many other parts of the country. Can you take us into confidence as to so far, how many water tankers have been procured, and can you take the country into confidence if there won't be any hiccups related to water in rural areas? The food parcels distribution in almost all parts of the country, we're experiencing corruption, particularly in John Taolo-Gaetsewe region in the Northern Cape, where we saw food parcels being sold to foreign national shops in Kuruman town, in ZF Mkau, where we saw a certain mayor halting the distribution of food parcels only because she was not involved. Are you prepared to take actions against such politicians or officials of municipality? Thank you.
Thank you, Honorable Member. Honorable Dodovu.
Thank you very much, Honorable Chairperson. Let me start by appreciating the presentations by the two honorable ministers. The presentations indeed inspire confidence, and for me, they demonstrate an unflinching commitment on the part of the ministers and the government to ensure that we tackle this pandemic. And I wish underscore say that as a government, we are very much excited that you're doing everything in your power to save lives and to ensure that our economy is running. My question to Honorable Minister of COGTA is to check whether have we put up the necessary systems and structures in place to ensure that the challenges that are pertaining to the PPEs acquisition, the food parcels, the water tankering are in place, because it is quite important to ensure that the systems are in place in order to ensure that there are no problems at the municipal level. And on that score, I want to check what are those systems and structures that are in place to ensure that we attend to those particular issues. Thank you very much, Honorable Chair.
Thank you, Honorable Dodovo. We will now request Honorable Mikalakis to ask his question. After that, we will have Honorable Moimang and then the member from KZN that indicated, and then we will allow the minister to respond. I just want the name of the member from KZN.
I'm next. It's Ricardo Mtem.
Honorable Mikalakis. Mikalakis. Honorable Mikalakis. Is the Honorable Mikalakis there? Mikalakis?
Yes, Chair.
Okay. Mikalakis? You can continue, you may. Is there any reason why you are not speaking? Can I go to the next participant? Honorable Muimang, whilst we are waiting on Honorable Mikalakis, can you continue with your question?
Thank you, Deputy Chair. Let me also appreciate the presentation. Mine is to Honorable Minister Nkosazana Dlamini-Zuma. Honorable Minister, let me appreciate the manner in which the department was able to provide leadership and the municipality to respond positively to the provision of water in communities through Jojo tanks. I know that in our province, the number of Jojo tanks distributed is 184, and the district where I'm based received 353, and Drom Rolon, that was referred to, received 221. But of course, the challenge that we are faced with relates to the long term beyond COVID-19. Is there any plan that is in place to ensure that municipalities are able to continue providing water to this municipalities, because this program is expensive beyond the municipalities' means. So I just want to check in terms of long-term anticipation of the pressure that is going to be on municipalities to continue providing water. Thank you, Chair, Deputy Chair.
Thank you very much, Honorable Moimang. Members, remember, this first few questions is in order for the minister to be able to respond before she leaves, but there can still be questions because the deputy ministers are available to respond. Is Honorable Mikalakis already ready to ask his question? Thank you. You may continue.
Thank you. My apologies. It seems to have been a connection problem. It seems to have been a connection problem, Deputy Chair. Deputy Chair, my question is...
Can we please mute the other people? Please mute their microphone so that we just hear Honorable Mikalakis. Landsman, mute, please. Honorable Mikalakis, you may continue.
Thank you, Chair. In the media briefing of the 25th of April, the Minister said that COVID-19 offers, and I quote, us an opportunity to accelerate the implementation of some long agreed upon structural changes to enable reconstruction, development and growth. The Minister also said that these opportunities call for more sacrifices and suggested that implementation of the doctrine of class suicide as promoted by Amilcar Cabral, the Marxist revolutionary socialist from Guinea-Bissau. This doctrine of Cabral called for the bourgeoisie to sacrifice its class position, privileges and power through identification with the working masses. Minister, do you honestly believe that this pandemic, from which people have lost their lives in South Africa and around the world, is really the right time to be pandering and driving political philosophy with regards to radical economic transformation? And more importantly, which social class in South Africa does the minister want to commit suicide as per the doctrine of Cabral? Thank you.
We will allow the minister to respond to these few questions. And after that, members, you will have an opportunity to generally ask your questions for COGTA as well as for health. But we will then start with the member from KwaZulu-Natal, and then it will be Honorable Klute. We will now give over to Minister Nkosazana Dlamini-Zuma to respond to these few questions. Minister.
Thank you. Where is the video? Thanks. Thank you very much. Let me first just put it on record that my letter that invited me to this committee said Tuesday, 26 May 2020, from 10 to 12.
Yes.
I just want to put that on record because from what honorable members are saying, they're saying as though I'm saying I'm going to leave before the time that I was invited for. I said I'd leave at 12 because the letter said 10 to 12. That's the first point. The first question, I must also put it on record, I'm not Mazoti's friend. And secondly, if anyone is doing crime in South Africa, they must be arrested. Whatever crime, whether they are a crime on cigarettes or crime on what, those people who are doing crime must be arrested. Now, in terms of tobacco, I would go to town about tobacco, but I won't go to town very much because the matter is in court as we speak. But let me say that COVID-19 is a novel virus which affects the lungs, and we know from some of the studies that have come from China, and even some that are now coming from the US. There's even a paper also from Oxford, and that indeed people who smoke do have problems with the lungs, as we know, and if they do get the infection, they are more likely than the non-smokers to get a more serious disease. If they get a more serious disease, it means they'll need more, they might need ventilation. That's the first thing I will say. But secondly, WHO has actually published health benefits of smoking cessation. And it has shown the short-term benefits and the long-term benefits. And the short-term benefits, I'll just read some to you. It says that if you stop smoking, in 12 hours, the carbon monoxide level in your blood drops to normal. 2 to 2 weeks, your circulation improves and your lung function increases. 1 month to 9 months, coughing and shortness of breath will decrease. And it goes on. I won't waste your time. It goes on about the benefits of cessation smoking, so ceasing to smoke. And secondly, the study that was done by the HSRC does show that a lot of people actually didn't go out and look for cigarettes. But I will leave it at that because the matters are in court. We will explain a lot more. Our lawyers will explain a lot more about smoking and COVID. And we also know that in our communities, when people smoke and they don't have a cigarette each, they share the cigarettes. 5 people or even more can smoke 1 cigarette. And that puts them in danger as well of contracting COVID if one of them has. So I would leave this matter of smoking and cigarettes there. It will be aired a lot more in court as the matter is in court. Secondly, the issue of water in the villages. Yes, it is a problem. It was agreed that the Department of Water and Sanitation will deliver tanks to the provinces and which will go to the districts and local government and local areas, and will also deliver water tankers, which will then supply the water into those tanks, into those JoJo tanks. And I don't have the figures with me here, but I'm sure the Minister of Water and Sanitation can give the breakdown per district and per province. And the reason I wouldn't want to give that breakdown myself is that even though I have the figures from the national, I'm trying, we've asked the provinces to pass their figures so that we reconcile and make sure that what we say is what happened in the provinces. But we do have numbers that, because some of the JoJo tanks were provided at the provincial level, some were provided at the national level. It's a measure. It's not a sustainable measure. And that's why earlier in my presentation, I said, whilst the short-term measures are
it cannot be our phone. Looks like it's a statement. But it's not my thing. Because I do that. Hello?
We need to send that same search party for the minister.
Is it
Minister,
what happened?
Minister, could you please unmute?
okay.
Thanks, Minister.
Okay. Now, I don't know where I was when I was muted. But what I was saying that the water tankers that have been supplied and the JoJo tanks, is clear that that's a short-term measure. And that's why in my presentation, I said, whilst the short-term measures are there, we are also trying within our means to drill more boreholes, and we've also asked TBSA and other partners to assist so that there could be more sustainable water sources. Also at the national level, the infrastructure, infrastructure fund, some of the projects could be water projects so that eventually we can have more sustainable water in the, especially in the rural areas. And then on the question of food parcels, of course, COGTA as a department is not really involved in distribution of food parcels, as you know. But some of the municipalities were involved. It's true that there may be councillors who may have done something wrong, and indeed, those councillors who do something wrong like that, selling food that should be distributed, there should be consequences. And it's not all councillors who are corrupt, but those that are corrupt, who have done something wrong, consequences must follow. And in terms of the question that the chairperson of our city committee has asked, in terms of whether we've put structures that there shouldn't be hiccups in terms of the distribution of water and water tankers. Of course, we have the districts which are usually the ones at the local level that are supposed to be water authorities. But the distribution of the national tanks, as I said, and tankers and JoJo tanks has been centralized through water and sanitation. And it's water and sanitation that has been distributing. Obviously, the local council, the local municipalities and the districts have to ensure that, working with water affairs, that those tanks and tankers are installed properly where they should be installed, and that they are filled with water through the tankers. In fact, if members would recall, we had to open up warehouses during level 5 so that, because some of them local municipalities were saying they can't find cement to install the water tanks, we had to open especially those warehouses so that the municipalities are able to install the water tankers in the areas. But if there are hiccups that are still there, we are not aware of, we will check with water affairs. And we had a long meeting yesterday with the mayors, all the mayors of the country and municipal managers, and they did not say that they still had hiccups in terms of installing and making sure that those tanks that were delivered are used as they should. But if they are, we would be happy to know and deal with them. And what is going to happen beyond COVID? I think generally government and our president have said that we should treat this COVID and post-COVID as war and post-war, and make sure that we will, as we kickstart the economy and as we look at the economy generally, we must ensure that South Africa, its economy, the basic needs of people are addressed in such a way that the next pandemic should never find us in the way we are today. So those things should be addressed. So we have to look at post-COVID as in a way an opportunity to reset. The chair, when he opened, he said, we mustn't waste a crisis. Indeed, we mustn't waste this crisis. We must look at the economy, the structure of the economy, the ownership of the economy, the decentralization of the economy. And that's why we are more and more talking about district, so that every district must have vibrant economic activity. So the decentralization of economic activity, the broadening of the ownership of the economy, and the transformation of our economy has to take place. And in the process, address some of the glaring needs that were very much exposed, whether it's in infrastructure, whether it's agriculture, food security, whether it's in transport. And of course, that has also got to look at the women, the youth to be part of the economy, and we have to look at small and medium enterprises, and also the co-ops are established, and we make sure that they are active and they are part of building resilient local communities. So that's what I would say, Honorable Deputy Chairperson. Thank you.
You have not answered all the questions, ma'am.
You were not recognized, member.
Neither were you. With all due respect, Honourable Minister, the question about the class suicide has not been answered by you.
Who is this chairperson
That's not
now?
a question, a political statement. Chair, can we please not be abused by honorable members? This honorable member is very out of order that is talking here about class suicide. It's a political statement. They are so desperate to make points whenever they wish.
Chief Whip,
my
can you
apology,
allow me? You requested me to chair the meeting. Can you allow me? Honorable member, Honorable Cook is not even chairing this meeting.
On a point of order.
And I want to say now there is no orders that I will take now. I am taking questions from members that indicated that they are going to ask questions, and we want to express our appreciation to Honorable Nkosazana Dlamini-Zuma. You responded to the practical issues that is important for the people of South Africa. No. So thank you very much. There is a member from KZN that indicated that this person wanted to speak. Can the member from KZN, if you are actually forfeiting your turn, I will give to Honorable Klute, but I first want this one that said KZN.
Honorable Majola.
Please.
I would also like to ask a question, Chair.
By raising your hand, I will get your name from the host officials. Honorable Majola, can you continue?
Thank you very much, Chair.
Chair, this is a travesty. I'm asking on a point of order. You must at least listen to the point of order.
I listened to your point of order. You raised the issue, the political statement that was made by Honorable Mikalakis. Now I'm requesting to continue with the meeting. Honorable Klute, it's unlike you. Honorable Okam. I'm Honorable Klute. After Honorable Majola, it will be you that will be speaking. Can we continue?
KZN now is forfeited. KZN.
No, is it forfeited?
Huh? KZN?
No, continue. Continue.
All right.
Who is speaking?
It's member from
KZN.
Yes. Thank you very much. My name is Ricardo Mtembu. I'm the chairperson of COGTA in KwaZulu-Natal. Let me start by welcoming the presentation brought from the MEC of Health and the MEC of COGTA, and appreciate the leadership provided by our president and his team. And of course, as the chair, when he was opening, alluded that this pandemic came whereby the country was not aware, no one was ready for it. But we must appreciate the leadership that has been able to rise above. As I'm sitting and listening to the meeting, I'm concluding that we have some who have interest of the people at heart, and we have those who have their own narrow interest. I think we are aware of the wage drivers who want to individualize the collective decisions, and we encourage our leadership to rise above. The masses are behind them, and we believe that, of course, we will reach a destination. And also, we want to commend the MEC of COGTA, regardless of attack unfairly that is directed to her within the collective.
What is the question?
But I think she is in line and she understands what is happening on the ground in terms of the cigarette, and we believe that the collective is correct. My question then, with the chairperson, the unelected chairperson there, my question is, how are we going to address the issue of reprioritization of budgets and IDPs in the municipalities, particularly because there are municipalities who have been struggling before the COVID-19 in terms of finances. And currently there is a challenge of revenue collection because some ratepayers, they are affected by the situation of COVID. So my question is any plan, because I'm not sure whether the funding that was promised or was announced by National is going to be able to assist municipalities. If you go to some municipalities, roads are damaged like you'll never believe. It's unwalkable in those roads and other infrastructural problems. So therefore, what is the plan to assist the municipalities to ensure that at least they not suffer more than what they have suffered? Thank you very much to my leadership.
Thank you, Honorable Mtembu. Honorable Klute. ABC Klute.
Chair, sorry to bother you. Before he comes on, will you recognize me as well?
You are following Honorable Klute. Remember, you indicated you want to speak in the second round.
Thank you. Thank you.
So, Honorable Klute.
Thank you, Chairperson. I was listening to everything that was mentioned today, and one screenshot that the Minister of Health showed us was the lack of income, hunger, economic downturn, social distress such as funerals, religious events, weddings. And I was wondering by myself, how did we end up at this in the world? And I'm going to speak about that elephant in the room right now because we need to attend to that elephant as well. We need to know the truth about COVID-19. There's little doubt that COVID-19 originated in China. The coronavirus started there. And I'm concerned when I read what happened in China where people were muted, they were silenced because they were not allowed to ask questions about coronavirus. Now, the past few weeks, there's been a growing concern and questions about how the Chinese Republic or the government there handled the coronavirus situation. And there's growing requests that there is an independent investigation to be done into how they did how they managed the whole coronavirus situation. My question to the Minister of Health, as Minister of Health of South Africa, will you support an independent investigation into China so we can have the truth about how the world and South Africa and our provinces came to a point where we have lack of income, hunger, economic downturn? Will you, Minister, support such an investigation? Just another question regarding the hotspots. You mentioned Mangaung quickly, and you just quickly said, and I quote, the various history of Mangaung being added as a hotspot. The maps that was circulated doesn't make sense. The one map shows Mangaung is actually quite safe or not that distressed, but now Mangaung is added to that hotspots. What was the reason for Mangaung being added? And then the last question is, we hear, and the other ministers can answer this, we hear smoking is bad if you're a possible COVID-19 candidate. But there is research showing the contrary, and I don't want to go into the merits of that. But my question is, for any research, scientific research to be done, you need to have peer review. So in other case, how it works is, for science to be scientific, you need to have an investigation about your theory. You have the data, you gather the data, and then you come to a conclusion. But you have to have your peers scrutinize your findings to say this is scientific. Can we have the peer review and the science behind the information we are getting that COVID-19 is, or smokers are at risk when you for COVID-19? And I'm actually concerned about the fact that the minister read the information from the WHO. It's just a statement. It's not really research. It's just a statement regarding smoking and COVID-19. In fact, the WHO says in that same statement they are in the process of conducting new research every day. So can we have that peer review, that hard data and scientific data to show us that smoking is bad for South Africans? Thank you.
Thank you, Honourable Klute. Honourable Boshoff.
Thank you very much, Deputy Chair. Minister, it's only natural for one to question the monitoring mechanisms of your department that are in place to ascertain that the figures provided by provinces are a true reflection of the reality on the ground. Given the fact that in some hospitals like the Grey Hospital and the Matata Hospital in the Eastern Cape has been reporting that the nursing staff are refusing to treat patients due to the lack of PPEs. Flights have been grounded, resulting in many tests or specimens being transported by road for up to 9 hours between provinces, and that information that has been shared with us indicate that a quarantine facility in Mpumalanga, 13 persons under investigation had escaped. There's also the issue of massive backlogs of test results that causes one to also question the figures we are being provided that are not as close to reality as one wishes to believe. What monitoring mechanisms, Minister, does your department have in place and are utilizing to ensure accurate results? Can tests that are being transported by road be trusted for accuracy? Will you ensure that all medical staff on the front line are provided with adequate PPEs and guarantee that every quarantine facility is secured so no persons under investigation do not escape and become a risk to others who are infected? Thank you.
Thank you, Honourable Boshoff. We will give to Honourable Mutsamai.
Thank you.
Honourable Mutsamai.
Thank you, the Honourable Minister. I just want to ask the Minister, how will the department assist the municipality that is under Section 139 on COVID-19?
Is it your question?
E.g. like Northwest. Did you get my question?
Is it your question?
Yes, ma'am.
Is Honorable Goya? Honorable Anel Goya?
Thank you very much, Honorable Chair. I just want to first start by saying that we appreciate the briefing from both ministers, and we welcome such an extensive briefing. But one needs to say maybe education needs to be broadened. It is an appeal that we need to broaden education so that people can understand the health hazards that are involved in smoking, which are even accepted by the manufacturers and distributors of cigarettes or tobacco products. Because even in the packaging, it is said that smoking attacks the lungs, smoking kills. So we shouldn't be malicious and behave as if it's a wrong phenomenon, which is a scientifically proven fact. What we need to do is to call on SABC. It's a call that we want to make, that there should be a call on SABC to intensify the fight against illicit trading of cigarettes, because that's the problem that we are sitting with currently. It works against the gains. But I want to ask the Minister of Health in terms of the health education programs and what their partnership is with the municipalities to ensure that we broaden health education, especially to the poor communities that do not have access to media. So I think we need to check that. And finally, I just want to say that so far, none of our ministers has been seen to be committing class suicide. Hence, the masses of them are still with us.
Honorable Goya,
if you go ahead with that work.
If you finish your question, are you through with your question?
Yeah, Honorable Chair, I'm done.
Honorable De Toy.
Thank you so much, Jane. Minister, the Minister mentioned that much effort is put to provide more sustainable water supply by means of boreholes. Now, currently in areas like Lichtenburg in the Northwest Province, some boreholes can't be used as a result of contaminated underground water by sewage spillages. Minister, can you confirm that as you can confirm, it has been found that COVID-19 has been traced in human stool or feces and of that of infected patients? My question, can the Minister confirm that it is impossible for boreholes to be contaminated by the COVID-19 virus as a result of sewage spillages? And then my second question, Minister, as a matter of transparency, could the Minister please provide a detailed list of everyone that forms part of the National Command Council and the reason why the country haven't been supplied with such a list up to now? Thank you.
Thank you, Honorable De Toy. Honorable Matibe.
Thank you very much, Deputy Chair. Part of my question has been covered in relation to the budgets in municipalities. But the question that I want to put forward is what is the impact of COVID-19 on what delimitations, more especially public participation, and also
what will be the role of the department to ensure that public participation indeed happens? Thanks.
Chair, are you still there? Hey.
Honorable Mohai, we seem to have lost the person. Do you wanna continue? Honorable Nyambi?
Who's following Zama? Who's following?
Yes, I agree that the House Chair can proceed whilst the Deputy Chair is lost connection.
Honorable Nyambi?
Honorable Nyambi.
Once it's available. Who's following Zama?
It's Honorable Christian.
Honorable Christian?
Thank you very much, Honorable House Chairperson. My question is to the Health Minister. The infection statistics have been relatively consistent with a mortality rate of just below 2% and an infection rate of around 3.5%. One of the most senior advisors of our Ministerial Advisory Committee and the chairperson of the South African Medical Research Council, Dr. Glenda Gray, came out against slow, gradual phasing out of the lockdown and certain regulations, stating that such an approach is nonsensical, unscientific, and has resulted in a spike of malnutrition cases, most notably among our young children. What the country is witnessing now is a concerted effort by yourself, your department, and others who seemingly do not wish to accept facts predicted on science. This has further been proven by the support for Dr. Gray by more than 250 members of the national and international academic and professional community. It is also important to note that Dr. Gray was the same medical professional who spoke out in 1998 against the then Minister of Health, Dr. Dlamini-Zuma's decision to block AZT, an antiretroviral that would have prevented mother-to-child transmission of HIV. This while the ANC was secretly sponsoring Virodine, a locally developed AIDS drug that was rejected.
Is this another presentation, Chair?
I'm coming to my question.
No, she's making a statement now.
The ANC government historically rejected medical and academic professionals when making decisions that could profoundly dire consequences on our people's lives. How are South Africans expected to trust this government to transparently and decisively deal with this pandemic and consequences of the lockdown, such as mass insufficient food supply and inevitable malnutrition? Thank you, House Chair.
Where's this question?
Zama?
Yes, ma'am.
Was that the last question?
Questions.
It can't be the last question, Chair. My hand is up.
Zama?
Honorable House Chairperson?
My hand is also up.
Honorable House Chairperson?
Can you give me the last two?
My hand is also been
I'll give you the last two. Honorable members, I'll give you the last two numbers.
Quite some time now.
My hand has been since the beginning. My hand has been up since the beginning, even before.
Zama, can you give me the last two hands?
Honorable Nita will be followed by Honorable Dango, Ambassador Dango. Thank you, sir.
Honorable Nita, and then followed by Honorable Dango.
But we've been raising our hands.
Thank you very much, Chairperson. Chair, my question goes to the Department of Health, Chairperson. When the minister was presenting, there was a graph that indicated that the Eastern Cape, Chair, and also the Western Cape, they have a number of people that are undetected who are infected by the coronavirus. What I would like to know from the minister, what is the plan to track such people? Because really, they can cause a serious damage to the two provinces that are seriously affected by the virus. The second question, Chair, is on the issue of beds. There's also indicated that the two provinces, again, they are having a very high number of infections. Yet in terms of beds, they are very low. Again, I would like to know, is there a plan in place to address those two challenges? And appreciate the work that the two ministers, through their council, that they are doing in curbing the coronavirus and the selflessness that they display in terms of ensuring that the poor communities, they get help. Thank you very much, Chef.
Thank you. Honorable Dango.
Thank you very much, Chairperson. My question is, how prepared are schools to deal with the pandemic? Is there enough and sufficient protective gear there for teachers? And is there an education program to actually teach and students and pupils about this pandemic? Because this pandemic is not going to go away tomorrow. This pandemic is going to be with us for a long, long, long time. But also an appeal to us as members of this House. We are in this pandemic. We are joined together in this. Let us not use this pandemic to play politics. It does seem that we want to play politics with this particular pandemic. We are playing with people's lives, and we should not do that.
Also,
thank you.
Thank you.
What do we do then?
Honorable members, let's allow the Honorable Minister to respond to the questions.
But
Honorable Minister,
we're not given an opportunity to ask questions. We've been raising our hands.
Zama, no.
You are not the only one, Honorable Zandave. Honorable Minister Mkhize.
Thank you very much, honorable members. Thank you for all the questions. And thank you to the chairperson for offering me the opportunity. The one question was raised by Honorable Mthembu. I do want to thank Honorable Mthembu for his kind words around the issues on the presentation and the approach to the pandemic from government. I think the issue that we are grappling with relates to the challenges to our budget as a result of the difficulties that are going to be enforced on our ability to maintain infrastructure. Even this morning, this is the issue that we've been discussing together with the Ministers' Committee on Budget. It's a major challenge, and I think we have to really work together because there will obviously be an impact on the maintenance of infrastructure. And so a lot of reprioritization will become necessary. So I do understand that aspect. The second issue raised by Honorable Klute refers to the slide wherein I spoke of hunger, social distress, and issues of loss of income and economic recession. These issues were basically tabled in the first meeting when we were discussing on the best way of prioritizing the lives of our people and took a decision on the lockdown. The approach was that immediately the lockdown is going to offer us a lot of advantages in dealing with the rapid spread of the infection. However, it will be very important for us to always consider that there will be other unintended consequences that we must always avoid. And as a result of that, the president had then gone out to announce the package of social relief to help with additional support in terms of the social grants, as well as the assistance to those who are unemployed, opening up UIF for those who were working but were not able to continue with work, support for small businesses and huge businesses. So the response to the issue that we raised we're basically saying there's a balancing act that we have to take into account. But we have already done the balancing in the sense that, firstly, we have gone to issue this package, which is supporting, to deal with the distress. We have also been involved in the consultation with various leaders of the church and the religious formations to look at how we can manage the issue of having to reintroduce activities at the level of the religious gatherings. We have also looked at a number of other issues that relate to how we can get back to normality. And that is in response to the fact that we knew we needed to keep a balance on the way. That's why the president spoke about a risk-adjusted strategy of easing the lockdown. So this we have dealt with. The issues that are being raised across, in the media about questions around China, certainly we have noted those issues. However, we have not really been favored with any issue that relates to any suggestions that there should be a reason for investigating any reason to any what we call wrongdoing from the point of view of the Chinese government. So we wouldn't really be part of that call. We would really say that we have noted a lot of lessons from China, from many other countries, and we do get lessons from the good work that they did in trying to contain the virus, and that in fact they have been the one country that's been able to halt the numbers from rising too rapidly, together with Korea and a few others. But many other countries, we're also learning from them in terms of what they are doing, even things that we must avoid, as it were. That is why we took our own approach to say we may not be reducing the numbers, they may not be declining yet, but our situation, our conditions are such that we have to keep our own balance in this regard. So we would not, therefore, have any basis to call for any investigation on China. We actually believe that we'll take lessons from all over the world. The other issue that relates to hotspots, well, if anyone was watching, would have noticed that Mangaung was amongst the parts of the country where there was a rapid increase in the earlier infections and positivity rate, and that to be a lot of work that was done in that area. It remains at risk, and so we have in the slides indicated some of the areas that we're watching, that we have to take into account areas where we think that there's still a risk of a rebound infection. And so that's why we have a look, we took that view on Mangaung. But the reality is defining a place as a hotspot is not a punitive decision. It's a decision to introduce additional health teams to support the area so that we can improve our response when the infection begins to rise again. So it's not a punitive issue. So when we look at it, we need to understand that we're trying to reinforce that particular area. So we're keeping it on a watch for that reason. The issue around smoking, look, I don't think I want to take time to get onto what the member is doing. The dangers of tobacco are well established in courts in South Africa, in United States, in different parts of the world. And so I don't think people must come and argue here that there's any benefit you can get from smoking. There's none. So let's not argue that way. If people want to sell cigarettes, if people want to smoke, then let's deal with it on that basis. But not deal with it because we think that there's something wrong if we say that tobacco is not good for anybody's health. It isn't. So let's leave the issue. Let's just focus. If people want to debate the issue from the point of view of saying that they've got businesses and so on, that's a different matter. And so in this case, there is no need for any peer review. We will accept the statement by WHO, and there is no benefit to anybody's health that comes from smoking. That's it. So I think we must understand that the real issue that arose here arose when there were definitions of essential services. And again, you can never say that's where tobacco is essential services. So The debate of what the business impact would be, the profits and so on, it's a very different debate. It mustn't be linked to health because there is no health benefit from smoking. The matter is in court, and so we'll leave it at that. The Honorable Boshoff raised the issues about Umtata and Freya. Yes, we have received those comments. In fact, they are members of members of staff, because some of them have spoken to them when they've sent messages around. We are following all of those. And certainly, I think we should accept that in a number of hospitals, there will be tensions where people feel they are not well protected. And I found that that would be a result of either inadequate training, so people don't understand what level of PPEs they need. And in some areas, there may well be challenges of PPEs. And so whenever there's a complaint of this nature, we go in there and investigate. I raise the issues with the MECs, and they've sent members to go into that area to try and attend to those issues. Every now and again, when these issues arise, we take them seriously, and we want to make sure that our members know that we will always protect them. We will make sure that PPEs are available. And if they feel that they are not well protected, they must raise the issue, and we will deal with it at that level. So it's very, very important that all those issues that are raised are actually being dealt with. The persons under investigation who escape must be arrested. We go and get the police to charge them and get them back so that they must be under isolation. No South African should be allowed to go all out and knowingly infect other people by actually going out and spread the infection when they've been asked to isolate. So that's a standard approach, and we hope that people will always be explained to so that they don't take it wrongly when they're asked to isolate. Because it's not a punishment. It's a precaution that you make sure that you don't infect other people. So it's very, very important that we must work together on this. And that's why I think I agree with those who have said education is going to be very important, that we ensure that all the people understand that it's not a punishment. It's actually for the good of your other fellow South Africans, that you don't go around spreading the infection. But it's not also a punitive issue. It's a matter of care that we have to give you some treatment if there is a need for it. So we will continue to work together to ensure that people understand this fact so that people can actually cooperate. Then the question of tests.
Honorable members, let's allow the minister to respond to the question that you have asked. You are protected, Honorable Minister.
Thank you. The question of tests, if there's any specimen that is not suitable, the experts in the laboratory will always indicate. So we must always feel that they are having our best interest, and so they will be able to guide us. And so I think we must leave the issue in their hands. At the moment, we won't even interfere. If the laboratory felt the specimen was unsuitable, that's it. It will have to be redone or whatever. But I think that they have the right as the laboratory experts to be able to guide us on that issue. So there wouldn't be no problem on that part. The Honorable Nzama raised the issue of the municipalities under 139. We don't have any specific focus onto the municipalities on whether they are 139 or whether they are on their own administration. All we're looking at is what is it that we can do to help the municipality to respond. And in this case, we have indicated a number of approaches. Firstly, the issue of community screening. The department at the provincial and national level will always go and reinforce the capacity on the ground to make sure that the screening takes place as expected. The case management, similarly, we will make sure that we will deal with the patients irrespective of whether the municipalities on 139 or not. It doesn't affect anything. Then when there's a hotspot and we need to intervene, or whether there's vigilance, we'll always make sure we work with the local structure. I think what is important from this member to say is that all the municipalities do need to be involved. Whatever the mode of administration, they have to be involved in us fighting, particularly as we deal with the issues of containment. So we'll need everyone to be working together. And the issue of being under administration is a local issue of how the decisions are taken But in terms of what we're talking about, it's something that's going to happen on the ground, in the wards, in the sub-district, in the entire municipality, in the entire district. Everybody needs to participate, irrespective of that state of 139. So it shouldn't affect us a lot. Then the other Honorable Goya raised the issue of support to communities with no access to the media. I think that question is spot on. We have to really mount a very strong publicity campaign to make sure that people have a proper understanding of what they can do to help us fight the pandemic. It's also important because it must be individual decisions that people take to ensure that the distancing is observed, to ensure that they do hand sanitation and use of masks. So all of this basically means that we have to continue. There'll never be a time when we'll say we've done enough on that on that aspect of communication. We have to communicate until everybody on their own can share this with their neighbors, with their friends, with their families, so that they are the ones who are monitoring and ensuring that there's a social behavioral change. Honorable Tutod, the issue of Lichtenberg sewage spillage, I'm sure the Honorable Minister, my colleague, will assist us to support those areas to see how they can get those things corrected. However, the bulk of the COVID-19 cases have actually been attributed to droplet infection based on an upper respiratory tract infection, where the contamination or the infection basically arises from to infect other people nearby. So from that point of view, we don't really take the issue of sewage as being a major factor here. All we're focusing on is that this droplet infection. We believe that the numbers are such that let's focus on what is clearly obvious. Obviously, that doesn't mean that we need to allow this the contamination from underground spillage of sewage. That's a separate matter altogether. It causes more gastroenteritic kind of problems with a coliform contamination. That is a very different issue. It is a problem on its own, but you don't associate it with COVID-19. Well, I'm sure you can write to the Director General to give you the names of who sits in the Command Council. There's nothing secretive about it. Unfortunately, I can't give a list as we speak right now. Then the other honorable member raised an issue of statistics. Well, I think we are quite comfortable with the statistics that we have, and the issues that are raised about the government working with scientists. Actually, this matter I have clarified in the public arena that we've got a ministerial advisory committee and a number of other experts that give us support, and we have made it public that anybody who would allege that we don't support, we don't work with scientists is actually untrue, that statement. We have also clarified the issue of the malnutrition in Baragwanath. Again, that we have indicated that is actually untrue, as it were. And so that for us is an issue that is not for debate. It's an issue that's just a matter of upfront, accuracy or factual accuracy of the statements. The other question that is relating to the statement made by Professor Glenda Gray, I got a call from her that she wanted to discuss this matter and considered on a number of issues, and she was going to do a public correction of issues that she understood were wrongly attributed to her comments, and therefore make that retraction. So we left the issue at that, and so as far as I would be concerned, there is no basis to even suggest that there's any interference with the academic freedom of anybody. I did note that there were other academics who had written a petition or they had written a statement in the public. However, I thought that the assumption that there was any threat to freedom of expression or academic freedom was misunderstood, because there is no such. Every scientist is very welcome. Every academic is very welcome to express their views. And certainly, as in a normal democracy, if anybody argues and expresses their views, they should be understood and respected as such. But when those views are incorrect and factually incorrect, they must be corrected. And that is basically the reality of how any democracy should work. And so I think we will just note that the public, as far as we would be concerned, is actually properly led with a scientific basis of the actions that we take. There are differences of opinions here and there, but I think what has been good is that all the political parties and everyone out there has actually focused on the fact that this is a major challenge for South Africa, and there's no need for us to politicize it. There's no need for us to grandstand on it. There's no need for us to try and score political points about it. We must just keep the public properly informed. And so whenever there's any sense of disinformation or inaccurate information, we'll step up to the fore and actually get it corrected. The Honorable Nkosazana raised the issue of contacts who have not been conducted, who have not been found. That issue is a matter of concern. As a result, therefore, we have taken the approach on the hotspots, which is what we are implementing in Cape Town City Metro, as well as other areas nearby which are affected, and other provincial centers where we see that the hotspots existing. The purpose of the intensive health experts intervention that we're putting up there is to actually make sure that we create a strong community health response. We are able to strengthen primary health care. We're able to make sure that all those who are positive are actually identified and are taken to isolation, that all the contacts are also traced and are taken to quarantine, because that way we will actually interrupt the cycle of infection. And when we've done so, we will then make sure that going forward, we detect new cases and cut down on the spread of the infection. I must say that the outbreak in the Western Cape is a matter that is of concern and is really occupying our 24-hour concentration in terms of what else needs to be done to contain the situation there. We're not expecting that we must close down the spread of the infection. It's not possible to do that. What is possible for us is to actually make sure that we keep dragging on the infection so that it doesn't spike immediately. And so we will continue with that. Now, the plan, therefore, is that we're increasing the number of beds for quarantine. We have actually, in the Western Cape, sent a team which is led by Nicholas Crisp and Dr. Nicholas Crisp and Dr. Kerrigan McCarthy and a few others to go and reinforce all the experts that we have sent into the area. They're working very closely with the MEC for health and also working closely with the head of department. And that whole team is actually giving to us the response that we need to make sure that every sub-district within the metro has got a wall-to-wall access to additional health care. Once this has been done in future, this would really help us to build a very sound system, because the real challenge in the Western Cape is that the patients are landing in hospitals. You've got the best care at the hospital level, but what we need is to reduce the rate at which people are landing in the hospital, because that's what will actually reduce the swarming of the hospitals by large numbers. So that's what we're dealing with in the Western Cape, in the Eastern Cape, in all the hotspots. So that is the plan for both isolation as well as for quarantine. And when we talk about uptake of beds, we're basically saying we need to increase those numbers. So part of the issue in the Western Cape is the cost. Now, the cost of treating a patient in a hospital, some of them, if we use the hotels, for example, the cost is high. So at the moment, we have actually got the Ministry of Police offering the police colleges to support the Western Cape Department of Health to quarantine some of the people and create more beds. There's also support from the army. So those are the plans that we're working on in the particular area. Then Honorable Tango has raised a very important question about the readiness as we go back to school. Again, here we are working very closely with the Minister of Education. It's important to increase the level of understanding of what needs to be done in the schools. I've seen that the unions are also still very anxious, so we are going to be working together to refine the protocols for returning to schools and also make sure that whoever needs to be protected will be protected. It will be important as well to understand that the overcrowding in the schools needs to be mediated by creating extra capacity to be able to open up distances between the learners and also make sure that for every child they are able to use the cloth mask, which even the parents can make themselves, and that within the community, they don't need to go for N95 masks. They don't need to go for expensive masks. They just need simple cloth masks, which we all can use. And all of that's going to be important. But I must say that this is early days and this is all new. So what is important is for us to learn from each other and give suggestions that will help us to improve the return to school. As we're looking at it, we're going to be having this pandemic for the next 2 years or so. And in the process, it's not sustainable to actually avoid going back to school. We will keep improving as we go along and we'll learn as we move on. So that is really how far I can take it. Chairperson, thank you very much.
Thank you, Nkosazana. Thank you, Minister of Health. Honorable members, as we are aware of the time, and we are very clear about our role and mandate of the NCOP. So we decided that as the house that represent the interest of these different provinces, we are going to allocate a maximum of 3 minutes for each province. We are aware that we do have some MECs and relevant members of the portfolio committees in our respective provinces, so that all of us will have a better picture of what is happening in our respective provinces over and above what is being presented by the ministers. So I will do them in alphabetical order, starting with Eastern Cape, the relevant honorable member from Eastern Cape.
Chairperson, on a point of order. House Chair.
Honorable Mkhize.
House Chairperson, there was a second round of questions which was identified.